guys, so today we are going to use Kybella, which has recently been approved to treat fat under the chin area, but we are going to, in this case, use it for what I'm calling the pit pooch, where you get this little fold of fat when you're wearing strapless dresses, and this bothers our patient. So we're just gonna apply first the grid to make sure that we're getting just the most precise injection sites. And what's great is it will temporarily swell and you'll see results in about a month, pretty significant results. So hopefully then she won't be as embarrassed when she's wearing straplesses and stuff. She doesn't feel like she has that little pooch of imperfection because she's obviously a very fit patient and otherwise has no other imperfections. So I'm gonna take away the extra little dots here. That's where she doesn't need to be treated. You can see the area I've already demarcated where she has that pooch. And all I'm gonna do, it's such an easy and painless procedure. That's what's so beautiful, no scars, no pain. I'm just gonna inject a little bit of product at each of these little points. 1, 2, 3, little pinch. How's the comfort?
I feel nothing. Painless.
Great. So there is already, the area's been pre-numbed. So when she goes home, there's a little bit of soreness, nothing terrible at all. That then goes away pretty quickly. The swelling is the most significant thing, and swelling usually lasts for about 3 days, and then the rest of the days it's still a little bit swollen, but it's not nearly as bad. And so I'm actually doing a little feathering technique where I'm going to use a little bit less on the sides and obviously a little bit more where the pooch is, because really we're not trying to get rid of all the fat in this area. We just want to make it so that it's a little bit smoother, has less folds. So I'm using a little feathering off to the side. Okay. Going back to that one for another 2 cc, just a little bit more in that one. And here's where I think she could use a tiny bit more. So, you know, it's going to become a little bit of an art how much you inject in this area, in individual areas. Some areas probably need just a little less. Like right here, I would probably use a little bit less because it's more like skin laxity than actual fat. So we'll get rid of the fat underneath, and we can always tighten up the skin laxity later with a radio frequency device, or maybe even sculpture a little bit underneath. And that's pretty much it for this side. How do you feel?
Great.
Fabulous.
Easy.